Well, I think what we have is just broad-based, uncontrolled community spread. We saw this start to take off probably around the Memorial Day period of time. I think that's one that we've heard over and over. I think we've continued to see, community spread. That is just something that is very characteristic of this disease. We know that it is spread by droplet from person to person, and the way to try to prevent that is through, a really very rigorous and disciplined use of masking and social distancing and so forth. And so bottom line is we probably haven't been doing enough of that. And since the order that the governor made last week to require masks, I certainly am hopeful that we'll see some control of this community spread. Well, I think the compliance is certainly much better than what I've noticed over the past week, just in my own coming and going, and over the 4th of July holiday. Literally, I did not see an individual in the grocery store without a mask, and I believe that if they tried to come in without a mask, they probably would have been denied, or they would have been offered one to wear. I think there's been a lot more of the kind of activity that we saw back in March and April when we did significantly blunt the curve. And that's the kind of behavior I'm seeing now. But again, the increase in cases we see now are the kinds of behaviors that were reflected 10 days to 2 weeks ago. And so, we're going to prepare ourselves for a very busy July in terms of increasing number of cases and increasing number of people that require hospitalization. But if we see what I've seen out there, and that's a pretty firm adherence to some of the mitigating behaviors, I think on the other side of July, we're going to see a much better time. Well, it's one that the governor charged me with back in March, and at that time there wasn't a real demand for hospital capacity and ICU capacity. We had a tremendous amount identified in our effort to preserve PPE, and we rode that out for quite a while. Over the past month, we've certainly seen an increased occupancy of hospitalizations related to both general beds, med-surg beds we call those, and ICU beds. The thing I'm watching most closely right now is the ICU beds. Those are hard to create, without some extraordinary efforts, as opposed to our general med-surg beds. We can create those a little bit easier. They're also those are patients that aren't quite as sick and require as much intense care. So the intensive care unit beds are the ones that I'm really following closely. Well, the whole state is pretty hot, I will have to tell you that. There are places that are more hot than others, I should say. And where we're seeing places that definitely have my attention, especially when it comes to ICU capacity, is Travis County, Bexar County, down in the valley, and Hidalgo and Cameron counties, as well as in the Harlingen area. That's what we're watching very, very closely. But truly, most places are pretty tight, even in Midland, Odessa, El Paso, and then of course your big metropolitan areas, Houston and Dallas, are continuing to see a very, very significant impact to hospitalization. Our larger metropolitan areas, they have typically more resources, and they're able to, convert med-surg beds to ICU beds pretty quickly. The other area that we're really seeing a choke point, if you will, is on the staffing. And so a lot of places have the ability to physically move into other areas, but they lack the staffing. And so we're working very hard with groups that we lean on to provide the necessary staffing in order to meet those needs. Well, there could be movement of medical personnel. RNs are the thing that's in greatest demand right now. There's largely is a physician community in most places to meet the need that's out there. But we are seeing physicians that make themselves available through our volunteer registry or through the Medical Reserve Corps. We're also leaning on the federal government to send assets our way in terms of medical personnel. And then again, we're looking to the private sector in terms of some relationships that we have with agencies to bring medical personnel personnel into some of the most needed areas. As an area may heat up and another one may cool down, then certainly, yes, there will be efforts with regard to those people that we've brought in to move them to other places where there's going to be increased demand. Yeah, I don't have them readily at hand. I do typically run through them, and I try to see specifically where are the places that I need to perhaps make a phone call into to make sure they are adequately staffed, that they do have the ICU bed capacity, which can really put patients at risk if we don't have that capacity. I'm not familiar just right off the top of my head as to where we are with East Texas. I will tell you, it has been hotter at times in East Texas than what I've seen in recent days, but I couldn't tell you exactly what that is today. I'm sorry. Well, I think with regard to overall testing, is there's just been an effort to try to really significantly ramp up the amount of testing in order to have a better understanding of just what is the incidence of the disease in the population and where are the areas that we could focus on more. There has been efforts to try to change our overall testing strategy, if you will, from what we do on these individual testing basis to something called pooled testing, where multiple samples are put into a single pool and then tested as to whether there's any positivity in that pool. That can dramatically increase the number of tests that you're able to do, and based on some of the ability to identify within that pool, you can then do further testing to determine whether people actually have the disease or not. It's something that has been recognized for a while, and as we're looking at trying to really ramp up the ability to test, pooled testing is something that's getting more study out there, if you will. Well, the lab capacity is going to be strained, especially if we're going to continue to do testing on the basis that we've typically done. And so it, to some extent, takes me back to the concept of pooled testing in order to really kind of stretch out the capacity of your individual laboratories. We are seeing, the return on results faster by some labs versus others. What we are trying to do and to direct people is that if there's a particular lab that's not performing, in other words, we're not getting a sample result back for 5 to 7 days, that's not a very helpful test result, frankly, in terms of actionable data. Not to mention the individual doesn't know, and the potential for them to perhaps infect other people, not knowing whether they actually have the virus or not. And so it's very important that we get a prompt result back, and by prompt I mean 2 to 3 days is probably what would be the expectation. We have many labs in Texas that in fact can meet that requirement, and there's some that we know that have not been able to meet it, and we just try to, one, make those labs aware of that. I'm sure they are, frankly, but also in terms of us directing citizens of Texans in terms of where to get those laboratory tests. We ask them to inquire what's the expected turnaround time. Well, I think the main thing that's happened with as far as the Phase 3 opening has been to pull back on the bars and some of the tubing type activities that were going on. We're just really trying to identify those areas that people tend to congregate at. And so right now, I would say the main thing is to really continue to push the behaviors that we know will mitigate the spread of this virus, and those are, as you've heard many times over, they're masking, they're distancing, they're hand washing, and they are staying away from each other to the extent possible, but especially for the people that are high risk of having complications from this disease. Those people really need to try to stay cocooned as much as they can without exposing themselves to the public in general. But as far as going backwards anywhere, I think we probably have a place where we really need to make this work. And the way to make this work is to really very rigorously adopt these behaviors that we know that will protect us and protect the people that we're with. And it will also allow us to continue to, see our businesses start to come back to life a bit, because a stagnant economy can have just as negative health consequences as this virus can. Well, I think for one, it's a little bit different. You know, if we just look at the numbers, it's hard to refute numbers if one place was seeing the same number of cases per day than in another. What those numbers don't take into consideration is the experience and knowledge that we've gained on how to treat the disease and our effectiveness in terms of mitigating some of the spread. What I think we're seeing is we're not seeing the death rate, you know, go up commensurate with the amount of disease that's being identified. That can tell you a few things. One, that we're understanding how to better treat the disease, and two, it's probably also the message that's clearly been adhered to by the people that are really at risk of having a fatality are really protecting themselves much more than perhaps people understood they needed to be protected in early days with this disease, as New York experienced. Thank you.